Welcome to My Hero 360, a community that features the voices of our heroes who bring awareness and advocacy for health conditions.
This video was developed in partnership with the HypoPARAthyroidism Association.
Patty Keating, welcome to My Hero 360.
Thank you. I'm excited to be here today.
We're excited to talk to you. So, you are the executive director of the HypoPara Association. Now, before we talk more about the association, I do first want to discuss how you came to work for the organization. So, you've been living with hypoparathyroidism for over 10 years. Can you share more about the condition for people who are not familiar with it, and how did you come to understand your diagnosis?
Yeah, it's really interesting. I'm 60 and my journey started at the age of 50. And my 49th year of life, I actually decided to do this get healthy and be ready for 50 and get, a trainer. And I started exercising and I was in actually the best shape I had ever been in my life. And then I was diagnosed with complex tumors on my thyroid. And my sister had passed away early on from a thyroid situation.
Wow.
And the doctor was like immediately, yes, we need to get these out. They're indeterminate right now, but we really are leaning, in a way that we need to get these out. And I had a second opinion. They agreed as well. And so we decided to take them out and they removed them. And, before surgery, you're talking to the surgeon and they're like, oh, this is the best. He does all the parathyroid surgeries. And I went in and I think I remember like a little tiny conversation about, there's like 1% of the people that end up with like a parathyroid. And I'm like, okay, yeah, what the heck is a parathyroid? I had no idea what that was or the level of degree that it affects the body. And so I had the surgery, and immediately after, I could feel like this buzzing and tingling, and I'm like, whoa, what is going on? And then I felt like a kind of like a vibration happening through my body. And, so I called the surgeon, what do I do? And he said, just keep taking calcium. It's just your calcium acting up. And then my fingers started to do, then my toes would cramp up, my hands would cramp up. And I'm like, what in the heck is going on? All the while, I felt like I was kind of losing my mind because I was like all over the place. So anyway, I was working with my endocrinologist. I was the only patient in the practice at the time that ended up with hypoparathyroidism. And, they were working right alongside of me, trying to learn as much as we could learn. And about 6 months in, I actually had a heart attack from the lack of calcium, magnesium, potassium. They took me in for heart catheterization. And during that, they're like, we're not doing a stent. We have no artery issues. Like, this doesn't make any sense. But really, what it came down to was the lack of calcium and magnesium, potassium that really caused the heart attack because calcium controls, the everything, or it affects it. So that's where I ended up finding the Hypoparathyroidism Association because I was like, now what am I going to do? This is like a lifelong sentence of I'm going to be hypopara. How am I going to live with this? Or am I going to live with this? I can remember at some points thinking, this is this is my life sentence. I'm going to die from this.
Yeah.
So I found that there was a conference happening and it was in Jacksonville, Florida. And luckily I was working down there in that time of my life. And I was able to go to this 3-day conference. And I remember sitting in the parking lot just crying. My friend went with me and that I worked with. And I was like, this is not a club I want to be a part of. Like I can't go in there. And she's like, no, let's go. We need to hear the information. We need to understand this better. And we divided and conquered. She said, I'm going to go into some of the classes. You go into those classes. We'll compare notes and we're going to learn as much as we can to be able to get you through this. So we went in, and I will say that looking around the room, I was scared. I was like, oh my gosh. But people began to embrace me and go, oh, who are you? And welcome in. Obviously it's a club that nobody wants to be in, but come on in.
Mhm.
And I remember sitting and eating lunch and dinners and stuff with doctors that were just so open and willing to talk to me about the condition. It was pretty heartwarming to see that there were people out there that were willing to help. So it's been a long journey. My surgeon did not tell me that they took the parathyroids out, which is the reason that I probably wasn't being treated as appropriately with the amount of medication that I needed to be able to continue on. Um, and I found that after, the heart attack, I ordered the lab reports and all the reports. I'm like, what went wrong? And it showed that the parathyroids were identified in the lab reports, so obviously they were taken out.
Wow.
Um, yeah, so it's been a tough journey getting there, having to go through that.
Mhm.
But I will say it's helped a lot, excuse me, in understanding um, the whole disease and what I needed to do to take charge of my life
Mhm.
to be able to just plow forward and not allow it to be a death sentence for myself.
Yeah. It's a big change that, I'm sure you weren't prepared for. And you said you were on this health journey and then this happens. And so it's just, yeah, that's a big change and disruption to your life. I want to ask, what are some misconceptions you think are out there about the condition that you would like to correct?
Yeah, I think some misconceptions might be that conventional therapy will work and will treat the whole person. I think that conventional therapy has worked for a lot of people for a lot of years, and it will continue to work for a lot of people. Not everybody's going to want to move on to new treatments or anything like that, but I think it treats the calcium.
Mhm.
But in my case, and in a lot of the different patient cases that we hear about, it doesn't treat the whole. So, for example, you can still have a lot of like brain fog and all the different symptoms, the muscle cramping and all the tingling and everything that happens, but your numbers may be looking okay, but it doesn't take care of all of the symptoms. The other thing that I think about is we do have a treatment option now, and we have several in the pipeline, which is very exciting. And it treats the PTH as well, that then the calcium is treated along with it. And I think the misconception, probably a little bit from patient perspective or as a whole, is, oh, I got a treatment. It's going to be 100%. This is my cure, and it's not a cure. In fact, we are still going to have those days when it's, not the greatest. It's just kind of like, diabetes. They've got tons of great treatments for diabetes, right?
Right.
But you treat it, but every day isn't great. There's some days you're going to go high and some days you're going to go low. So I think it's an adjustment. So I think maybe potentially the misconception that it's 100% going to go away is not reality. That once we're hypopara, and we will have a treatment that helps us live much better, but not 100%.
Mhm. And we're going to talk about treatment in a little bit in our conversation. But when you say kind of standard treatment, that's supplementation of
Hmm.
different vitamins and minerals, right?
Yes.
Yeah.
Yes. And I mean, it's calcitriol, it's calcium, which, the challenge with that is for me, in the 10 years ago, I had the heart catheterization. We didn't find any issues with the arteries or anything. Fast forward 10 years after an enormous amount of calcium and an enormous amount of calcitriol trying to get myself level, I now am moderate to severe calcifications. Now, you could say, yeah, a 60-year-old woman's going to have issues, which is true. But think about that 10-year period, and from nothing to where we're at today is kind of, well, we could probably point a little finger at that.
Yeah, absolutely. And so I want to talk about the association and your work there. So you worked in the beauty industry for many years. You worked in leadership roles, overseeing a network of beauty locations. And now you've parlayed all of that leadership and executive knowledge and experience into your work at the HypoPara Association. So you started as a volunteer and then you joined the board and served as chairman before transitioning to your current role as executive director. So what first drew you to the organization and how did you learn about it?
Yeah, I think, like I mentioned earlier, is in a quest to be able to help myself.
Mhm.
I found the conference, and from there, I spent the next couple of years really trying to get myself again under control. So I was reading every paper and grabbing everything and taking it into my doctor's office and, begging for help. And they really were great in being able to listen to things that I brought in and thinking about different options. So I think that really it was about that. It was about like, how do I do that? And then once I actually got myself to a point where I wasn't running to the emergency room every month, sometimes a couple times a month. Because imagine anytime my heart would flutter, I'd be like, oh my God, it's coming again. I'm going to have a heart attack again. So once I got myself stable and I felt like, okay, I can somewhat live this life, I then thought, and it took me a while to get over what was done to me,
Mhm.
right? Because I went in to have a thyroid out and ended up with a lifelong disease,
Yeah.
which a lot of our patients do. So once I was able to actually accept that
Mhm.
and decide that I was going to make this a mission to help others so that they don't get in this situation, or if they do, in our case as the association, how can they live their best life from there, right? We are a victim of, right? We are, but we can live our life as a warrior and be able to help ourselves and help others by turning around our thinking and our treatment a little bit to be able to do that.
Mhm. And I think it's up to about 75% of people who have the condition, it's post surgery that
Yeah.
they get this.
hmm
Yeah.
Yeah. So, like I said, you go in there for whether it's a neck surgery or a lot of people are treated for cancer
Mhm.
and these type of things, but you come out with a permanent lifelong disease like that. Really, there is no cure.
Mhm.
And at the time, there was really not a treatment
Yeah.
option.
Mhm.
Now I feel super hopeful with the treatment options that will be coming around.
Mhm. Yeah. Yeah, that's scary, as you mentioned,
hmm
to go in and come out with this lifelong
Yeah.
uh, thing you have to manage now. What would you say is the association's mission, and what are some of the near-term goals that the organization is working towards?
Yeah, I think the our mission is really to impact the lives of anybody that's affected by hypopara. And what that means is patients, caregivers, doctors, um, uh, um, researchers, investors, because we need people to continue to invest in the research for this disease. So it's really to be able to impact them. And we do that through education, through advocacy, through research, doing all kinds of different things to really be able to elevate the patient voice in
Mhm.
this disease so that it's not just the medical pieces of it. Because again, if you're treated with conventional therapy, a lot of times your numbers, your lab levels will be okay, but you still don't feel good. So that patient voice really needs to be heard. And so we're making sure that in whatever we do, we get out there to share not just our voice and what's happened with us, but all of the patients all around. Um, in different venues. We've been on Capitol Hill, we've been to the state level, we've been to the, regional level, all these different places on a continuous basis. We're getting ready to start up conference season. So that means we will be attending all these conferences where there's clinicians, researchers, investors everywhere. And we just shout it as loud and proud as we can about the patient journey so that, people will continue to invest in research around hypopara and continue to invest in treatment options for us.
Mhm. I imagine that can be frustrating where you're saying your levels look good, but you don't feel good. And I think
Mhm.
most people want to wake up every day and feel the best that they possibly can. So I imagine that's really, difficult for patients to deal with. And you've talked a lot about how you want to help patients, give them a voice, improve outcomes, research. What do you hope the association, or how do you hope the association can move the needle when it comes to clinicians, and doctors?
Yeah, I mean, you know, if a clinician is in their practice for a really long time, and whether any kind of a hairdresser is in the same practice for 30 years, you do sort of the same things that happens. This is a rare disease. There's 10,000 rare diseases out there. We certainly can't expect every clinician to understand our rare disease, but it's really about helping them to learn more and to be open to the conversations about the patient's daily lives, how conventional therapy is affecting their body, and how new therapies can actually treat the whole person because it's hormone, right?
Mhm.
Calcium, we're just treating that calcium piece. The parathyroid is a hormone, so we need to treat that piece of it, which really, based on our community's experience, for the most part, has really helped in their overall quality of life.
Mhm.
So, really, it would be about that.
Mhm. And you guys are doing a lot, and have a lot of goals. What would you say is one of the most exciting things you've seen, happen during your time at the association?
Yeah, I think us getting helping to get the treatment to market. We did a externally led patient-focused drug development meeting, ELPFDD, with the FDA, and the treatment that was on the table actually didn't get approved. But then we did this meeting, and honestly, probably, I think it was like 6 months later, they actually then got the approval. So we do feel that those 13 patients that sat there and gave their story, the people that participated online, the enormous support from the community really sharing their story of how hypopara impacts them made a huge difference in that approval and the awareness of hypopara in general. Because clinicians are taught in school, and this is what they tell us. There's a paragraph or two in the textbook that they learn about this. But they're then, they may not see a patient for years and years or ever for that matter. So it's really important for them to understand not just those textbook symptoms, but how those symptoms impact somebody's daily life.
Mhm.
And that's what one of our goals was, to be able to get in front of the FDA to share that. And honestly, they told us afterwards it really taught them a lot, including our medical experts. They don't always, unfortunately, have the time to hear the whole story, but those 13 people, they did an amazing job, and it was all different aspects of hypopara, some genetic, idiopathic, post-surgical, all people that have been early diagnosed, late diagnosed. Yeah, it was a powerful moment, that, and then really being able to just get out there and talk to clinicians that it's not about Tums. Tums has a lot of calcium, yeah, but it's not about the Tums. It's about treating the whole patient.
Now wait, Patty's story isn't over. Catch part 2 now.